Let me begin with a question that many men have wondered about privately, yet very few feel comfortable asking out loud. What actually happens to the prostate if a man masturbates every day? Is it healthy? Is it harmful? Could frequent ejaculation protect the prostate? Or could it slowly create problems over time? If this question has ever crossed your mind, you are far from alone. In fact, in clinical practice, conversations about sexual frequency are some of the most common discussions I have with men of all ages. But the answers they receive are often confusing. Some sources claim daily ejaculation is essential for prostate health. Others insist that frequent release drains energy or weakens the body. The truth, as it often does in medicine, lies somewhere between those extremes. I'm Dr. Olivia, and today we're going to explore what really happens inside the male body when ejaculation occurs frequently, especially when masturbation becomes a daily habit. We'll talk about the biology of the prostate, how ejaculation affects the gland, what research suggests about prostate health, and when frequency might become excessive. Most importantly, we'll separate myths from physiology. Before we begin, tell me in the comments your age and where you're watching from. I always appreciate seeing how many men around the world are interested in understanding their health better. Now let's begin with a simple but essential question. What exactly does the prostate do? The prostate is a small gland located just below the bladder and in front of the rectum. It surrounds part of the urethra, the tube through which urine and semen leave the body. Although the prostate is relatively small, roughly the size of a walnut in younger men, it plays a crucial role in male reproductive health. Its primary function is producing prostatic fluid. This fluid becomes part of semen. It contains enzymes, proteins, and minerals that support sperm survival and mobility. When ejaculation occurs, the prostate contracts rhythmically to push this fluid into the urethra, where it mixes with sperm and seminal fluid from other glands. In other words, ejaculation is one of the prostate's key mechanical functions. What happens during ejaculation? During sexual stimulation, the nervous system signals the reproductive organs to prepare for ejaculation. The seminal vesicles release their fluid. The prostate adds its contribution. Sperm travel from the testicles through the vas deferens. All of these components meet within the urethra. When climax occurs, muscles contract rapidly and push semen out of the body. This process is controlled by complex interactions between the nervous system, hormones, and pelvic muscles. It typically lasts only a few seconds, but those few seconds involve remarkable coordination. After ejaculation, the prostate relaxes and returns to its resting state. Now, let's explore the central question. If ejaculation occurs every day, particularly through masturbation, what happens to the prostate over time? The answer depends on several factors. First, the prostate is designed to produce and release fluid regularly. Ejaculation helps empty the gland. This process is similar to other organs that release secretions as part of their normal function. Some researchers believe that regular ejaculation may help clear prostatic fluid and prevent buildup of inflammatory compounds. In fact, a large observational study published in the medical journal JAMA followed more than 30,000 men for nearly 2 decades. Researchers observed that men who reported higher ejaculation frequency tended to have a lower risk of developing prostate cancer later in life. The theory behind this finding is relatively straightforward. Regular ejaculation may help flush out potentially harmful substances that accumulate in prostatic fluid. However, it's important to understand that this study shows correlation, not absolute cause and effect. Frequency alone does not determine prostate health. Lifestyle factors also play major roles. Let's examine several potential benefits that researchers and clinicians have discussed. First, fluid turnover. The prostate constantly produces secretions. Regular ejaculation helps clear this fluid. Without release, fluid is eventually reabsorbed by the body, but periodic release may help maintain gland function. Second, reduction of pelvic congestion. Some men report pelvic discomfort or a sense of pressure after long periods without ejaculation. Regular release may relieve that pressure. Third, stress reduction. Ejaculation triggers the release of several neurochemicals, including endorphins and oxytocin. These chemicals promote relaxation and emotional well-being. Chronic stress is associated with inflammation and hormonal imbalance. Reducing stress may indirectly support prostate health. Fourth, improved sleep. Some men experience deeper sleep after ejaculation due to hormonal changes involving prolactin and oxytocin. Quality sleep plays an important role in overall hormonal balance. Can ejaculation too frequently cause problems? While moderate sexual activity is generally healthy, extremely high frequency may create temporary effects. One possible issue is temporary prostate irritation. If ejaculation occurs many times in a short period without adequate recovery, the gland may become slightly inflamed. Symptoms could include mild pelvic discomfort or increased sensitivity. Another possible issue is psychological rather than physical. When masturbation becomes compulsive rather than intentional, it may affect mood, focus, or relationships. Biologically, the brain's dopamine system adapts to repeated stimulation. Over time, some individuals may experience reduced sensitivity or decreased motivation. This effect is not caused by ejaculation itself, but by compulsive behavioral patterns. Balance remains the key factor. Frequency patterns often change as men age. Younger men typically experience higher testosterone levels and stronger libido. After age 40 or 50, hormonal levels gradually decline. This does not eliminate sexual desire, but it may change how often a man feels the urge for ejaculation. For many men over 50, sexual activity 2 to 4 times per week feels natural. Others may prefer daily activity. Both patterns can be healthy if the body feels energized and comfortable. The prostate does not require a strict schedule. The relationship between ejaculation and prostate enlargement. As men age, the prostate often grows larger. This condition is called benign prostatic hyperplasia. An enlarged prostate can press against the urethra and affect urination. Symptoms may include frequent urination, weak urine stream, and difficulty emptying the bladder. Some men wonder whether ejaculation frequency influences this condition. Research has not shown a direct cause and effect relationship. However, maintaining healthy circulation and reducing inflammation may support prostate health overall. Lifestyle factors such as diet, exercise, and body weight appear more influential. When it comes to prostate health, several lifestyle habits have strong scientific support. Diet plays an important role. Consuming fruits, vegetables, whole grains, and healthy fats supports metabolic health and reduces inflammation. Physical activity improves blood circulation and hormonal balance. Exercise also helps maintain healthy body weight. Obesity is associated with increased inflammation and higher risk of prostate problems. Sleep quality influences testosterone production and immune function. Chronic sleep deprivation can disrupt hormonal balance. Stress management is another critical factor. Long-term stress elevates cortisol, which can affect many body systems, including reproductive health. Compared with these lifestyle factors, ejaculation frequency alone has relatively modest influence. Perhaps the most practical advice is simple. Pay attention to how your body responds. If daily masturbation leaves you feeling relaxed, balanced, and energized, there is usually no reason for concern. If you experience discomfort, fatigue, or emotional distress, it may be worth adjusting your habits. Your body provides feedback. Understanding that feedback is more useful than following rigid rules. There are situations where professional evaluation is important. Persistent pelvic pain, blood in urine or semen, painful ejaculation, sudden changes in sexual function, or difficulty urinating. These symptoms may indicate conditions that require medical attention. A urologist can perform examinations and tests to determine the cause. Daily masturbation does not automatically harm the prostate. In many cases, it represents normal sexual expression. The prostate is designed to release fluid periodically. Regular ejaculation may even offer certain benefits. However, frequency should remain balanced with overall health and lifestyle. Sexual health is one component of well-being. It interacts with sleep, stress, nutrition, relationships, and physical activity. Focusing on overall vitality provides a more meaningful path to long-term health. The human body is remarkably adaptable. The prostate is a resilient gland designed to function throughout a man's lifetime. Daily ejaculation does not inevitably damage it, but neither does it guarantee protection against disease. The real key to prostate health lies in maintaining a balanced lifestyle. Eat well, stay physically active, sleep adequately, manage stress, and seek medical advice when something feels unusual. I'm Dr. Olivia. If this conversation helped you better understand how ejaculation relates to prostate health, consider subscribing for more evidence-based discussions about men's health. And tell me in the comments, what questions about male health would you like explored next? Remember this, your vitality is not defined by frequency. It's defined by balance, awareness, and the choices you make to support your health every day.